Welcome to Chapter 2, in which we look at the organizations that shape our community and public health. So here are the objectives of the chapter. And so that after we study this chapter, we are going to be able to summarize the need for organizing to improve community and public health. This is a lot of work. Why is it worth doing? Explain what a government health organization is and give an example of each at the local, state, national, and international level. Discuss the role of the World Health Organization. Briefly describe the structure and function of the United States Department of Health and Human Services. State the 3 core functions of public health. List the 10 essential public health services. Describe the relationship between a state and local health department. Explain what is meant by the term whole school, whole community, whole child. Define the term quasi-governmental and list the 4 primary activities of most voluntary health organizations. Explain the purpose of a professional health organization or association. Demonstrate how philanthropic foundations contribute to the community and public health. Discuss the role that social and religious organizations play in community and public health, and identify the major reasons why corporations are involved in community and public health. All right, so we've only been doing community health on the local level in a way that is ongoing, meaning it doesn't just kind of pop up and then go away, for about the past 100 years. Only in the past 100 years have communities taken explicit actions to deal aggressively with health issues continuously. Here's what I think is the issue. I think in the past, we only did it if it was absolutely needed. I think that the belief was the government's job is not to be overly involved in people's health, and that the government should just be about protecting private property. And I also think that our communities were more linked by family or religion or some kind of common identity that would allow communities to better respond to health crises in a way that today's won't. I think that today people's primary identity is that of a citizen, and a citizen looks to its government to do things like help with health prevention and emergencies related to health. I also think that we've realized that the government actually can do a lot of good. I think that in the past there was kind of the belief that there was no point in doing it. The government's corrupt, and sometimes that was true. But I just think that recently we just turned to look toward the government for things that maybe the family used to do or the religion used to do. So I think this kind of just follows in that path. So community response to our own problems are hindered by various issues. So things that get in the way of a community responding is the fact that most resources are oftentimes held away from the community, especially if you're in a local rural community like ours. A lot of times the resources that are given by the government are held in Springfield or Chicago, far away. It's more efficient to do that for sure, but it also creates a problem when the emergency is right now and we need the services right now, but they're a few hours away. Or we all need them all across the state, like we did with COVID and masks, but they can't deliver those everywhere all at once. The 3 classifications of the 3 classifications of health organizations are based upon where it gets its funding from, the responsibilities that it has, and how it is organized. And so the 3 organizations here are government, quasi-governmental, and then non-governmental. So we're going to talk about each of those different types here. We're going to start with the government. Government health agencies are part of the government structure. They are people who work for them are government employees, and they can exist on the federal level, state level, and then the local level. And they are primarily funded through tax dollars. It is for the people, therefore it is funded by the people. The government raises the taxes and then spends the taxes there. It's also managed by government officials. right? And generally, the agency has an authority over some specific geographical area. So for instance, you wouldn't expect to see the Cobden Health Organization taking over and doing things in Paducah, let's say, because that would be outside of its geographical area. The four levels that they exist on, they're international, the national, state, and the local level. And so we're gonna zoom out and to the international level and then kind of slowly zoom in. The international health agencies, the one that is most widely recognized is the World Health Organization, or WHO, and it was started in 1948, and it is headquartered in Geneva, Switzerland, which is one country north of Italy, there in Europe, and then it has 6 regional offices around the world. It is open to any nation that is willing to accept the WHO's constitution, and then that it receives a majority vote from other members within the WHO. So the vast majority of countries are a part of it. 194, there's somewhere around 200 countries in the world. So, the mission and the work of the WHO, its mission is to attain the highest possible level of health by all peoples. So pretty general, right? We want all peoples in the world to have the highest possible level of health. That gives us lots of flexibility to do a lot of different things, whether it's mental health or substance abuse or things related to toxins. And on a practical level, what it does is it provides technical assistance to countries, helping them organize, helping them with setting international health standards. These are the levels of mercury, let's say, in your water that we think that the body can handle, but above that, I think you're going to run into these problems. So here's how we recommend that you handle water systems and things related to that. It's going to coordinate international response to health emergencies. So if there's a health emergency, say in an island nation, and there's lots of different organizations that want to go in and help, it's going to help coordinate those to make sure you're getting the most bang for your buck. It is not very often sending doctors and nurses to specific places. It's more kind of behind the scenes, helping with logistics and structure and doing research and helping the countries help themselves, right? Providing guidance on important health issues. The work that they do is financed by member nations. They're not collecting taxes themselves. They're relying on the nations that are a part of it to provide money to it. And it is famous for helping to eradicate smallpox through vaccines. All right, so zooming in a little bit farther, let's talk about national health agencies. Every nation has department or agency within its government that is responsible for protection of health and welfare of its citizens. In the United States, our national health agency is the Department of Health and Human Services. That is the primary health agency that we have. However, there are other agencies that also contribute to health, like the Department of Agriculture, which is responsible for inspecting meat and dairy products, and it coordinates the food stamp program for WIC. The EPA, which is responsible for the Environmental Protection Agency, also related to humans' health. OSHA, which is about worker safety. And then DHS, which is the Department of Homeland Security, which monitors terrorism in the United States. So the Department of Health and Human Services is headed by the Secretary of Health and Human Services. They're appointed by the President, part of their cabinet. And it is organized into 11 different operating agencies. So this is a gigantic organization, and there are 11 different agencies, sub-agencies that operate underneath the Department of Health and Human Services. It has over $1 billion budget, and it serves people from the time that they're born to the time that they die. The different agencies that operate under the Department of Health and Human Services are, there are actually two slides of them here. Let me go into a little bit of detail on what these different agencies do. The Administration for Children and Families is primarily focused on young members of our society, youth, and then helping their parents support them. The Administration for Community Living is focused on elderly and helping them access their community. But realize that even just between those two, you're going to have some overlap. For instance, what if a child is being raised by its elderly grandparents? Well, then both of those agencies are going to be interacting with the family. Agency for Healthcare Research and Quality. This is kind of quality control for the Department of Health and Human Services, to making sure what is the healthcare that's happening in the United States is of the highest quality, is what they're doing, is it been proven to be effective? The term for that is evidence-based. The Agency for Toxic Substances and Disease Registry is related to, or is working with hazardous substances in the environment and their impact on the public's health. It's going to research hazards and the effect that they have on the human body. It's also responsible for closing areas that are contaminated and responding to chemical emergencies. The Center for Disease Control and Prevention, oftentimes just referred to as a CDC, is a very large organization that is the leading health protection agency. It maintains records, it analyzes disease trends, it reports on all types of various diseases, it stays abreast of new health threats, it tackles the biggest health problems in the United States using science and technology to prevent disease, and focused on prevention. This was talked about a lot during the COVID-19 epidemic that we had, because that is a new disease. It is a trend. It's related to maintaining records. All right. Other agencies that exist in this umbrella of the Department of Health and Human Services: the Food and Drug Administration, which is responsible for human and veterinary drugs, biological products, medical devices, safety of food, of our food supply, cosmetics, and products that emit radiation. It's heavily involved in regulatory activities that inspect meat and dairy products. Again, a little bit of an overlap there with the environmental, no, what was that agency we talked about a few slides ago? The agriculture, the Federal Department of Agriculture. It's responsible for inspecting meat and dairy products, restaurants, supermarkets, and other food outlets. Also, I think of this agency when there's a new drug that wants to be brought to market. You discover the cure to cancer. Well, you first have to go through the Food and Drug Administration to make sure that the pill that you're selling is safe and that it's more effective than the placebo effect. So, the Centers for Medicare and Medicaid Services, again, large budget for this organization because 34% of Americans are covered either by Medicare or Medicaid. Medicare is focused on the elderly, and Medicaid is focused on providing health insurance for usually the poor and disabled. The Health Resources and Services Administration. This is for people who are low income or who are uninsured or who live in an area where health care is scarce. Again, a little bit of overlap with the one we just mentioned. Indian Health Services. It is providing health services to American Indians and Alaskan Natives. The National Institute of Health is a medical research center that is focused on enhancing the health, lengthening life, and reducing the burdens of illness and disability. So primarily about research. And then Substance Abuse and Mental Health Services Administration, sometimes referred to as SAMHSA, is about substance abuse and making sure that we are utilizing the best, most effective means for combating, substance abuse, alcoholism, mental health problems, and I'm sure they have their hands full with our opioid epidemic. All right, let's continue zooming in now, talking about the state health agencies. So all 50 states have their own state health department, and the purpose of that state health department is to protect the health of the people who are residing in that state. Generally, it's headed by a medical doctor who's appointed by the governor. How does this practically work? So here on this chart here, we have kind of a visualization of the functions of public health, right? And so in general, if you want something to be effective, whether it's a public health service or anything else, you have to have a good understanding of what is going on. So we're going to call this you're going to have to do an assessment. You're monitoring what's going on. You're diagnosing, you're investigating, and you figure out, okay, this is the problem here. The next step is to work on policy development. You need to inform other people about what's going on, educate them, give them the power to make the change that's needed in order to change the situation. You're going to have to mobilize the people who you are connected with. There's very few independent heroes. You have to be connected with other people and have a working professional relationship with them, people who are actually in the communities themselves. Okay, and then the last part there is assurance, and this is about helping the people who are implementing the policies, so enforcing the laws. If people are working in isolation and they need additional services, linking them with the care that they're needing. Making sure that the people who are carrying out the work are able to do it. They are competent. And then the last thing would just be to evaluate, what are you doing? Is it working? Is it making a difference? Okay. All right. Most health departments are organized into divisions or bureaus. Many play many different roles, such as establishing health regulations, providing a link between federal and local health agencies. You can think about the state as being kind of the middleman that's taking the information and the funding from the federal government and providing it to the local government. Think about those are the people who are kind of on the ground working with the people, the actual everyday people. And the state health departments act almost like a boss for the local health departments, and like a good boss, they provide assistance such as laboratory services for the local health departments that may not be able to afford it. When local health departments run into problems and have questions, they call the state departments and ask for guidance and assistance. All right, now we're on to the local health departments. So we've zoomed in completely from the international now to the local. Oftentimes these are divided based upon how large the group of people are. If there's a population with more than 50,000 people, then it's probably going to be a city health department, where if it's more rural, then it's going to be put into a county health department. State mandated services are provided here. So if the state says that every county should have a place where you can bring kids before they go to school to get their vaccines, well, it's happening not at a state level, but at a local level. It also includes things like inspecting restaurants, public buildings, and public transportation. They're going to be detecting and then reporting certain diseases. So during the COVID outbreak in 2020, if there was somebody who had been detected, they go to their doctor, the doctor says, oh, we run a test and you have COVID. That information is passed on to the local health department, which then passes that on to the state, which then I guess passes that on to the federal. They also collect vital statistics, which will be things like how old somebody is, their ethnicity, and their relationship status, when they die, when they're born, things like that. Approximately 2,800 local health departments in the United States. So again, this is kind of the place where the clinical services are provided. This is where the professionals, the doctors, the nurses interact with the people. So, local health departments are typically managed with a board who hires a health commissioner. Maybe that health commissioner is a doctor, or maybe they have a connection with a doctor who gives them advice. And then underneath that health commissioner, there's different departments: environmental health, health education, nursing, vital statistics, chronic disease, and communicable diseases. A couple of definitions here. Chronic diseases are those diseases that are expected to last longer than 3 months. So for instance, diabetes, heart disease, okay? As opposed to acute diseases, which are like the common cold. It's expected to, not remain in our bodies for very long. It's not related to how deadly it is. So for instance, COVID-19 has, killed 1 million people, but it's not a chronic disease. It's an acute disease. Yellow fever, deadly disease, but it's acute. So in the United States, we tend to think of chronic diseases as being more deadly because for us they are, because we've gotten really good at treating acute diseases. And then communicable diseases are diseases that are passed from one person to another, like the common cold, not cancer. Cancer would be a non-communicable disease. Whole school, whole community, whole child. So schools are under the category of governmental health agencies because they're funded by tax dollars. Schools have a great potential for impacting community health. One, children spend an incredible amount of time in their school systems. Also, school systems are ingrained in the community in the way that police officers, the postal service, the mayor's offices are not. And typically people trust their local schools. They feel connected with them. They know the teachers. They have a long-term relationship with them. And the students oftentimes bring home whatever it is they're learning at school and share it with their parents, grandparents, siblings. And there's good reason for the school to be involved, not just because the government tells them to, but because if, say, a student is sick, it's likely they're not going to be able to focus very well, or if they have a toothache or something like that. Quasi-governmental health organization. The term quasi refers to, it's almost like a sort of. You're sort of one thing, you're sort of another. And so these are health organizations that have some official responsibilities given to them by the government, but they operate privately, more like voluntary health organizations. So they may get some funding from the government, and they also may get some funding from private sources. An example would be the American Red Cross or National Academy of Sciences. Again, it's given some responsibilities, like the National Academy of Sciences may be given a research question by the government, but then it's kind of allowed to conduct its work independently. Let's talk about the American Red Cross. It's pretty well known. Its official duties from the government are to provide relief to victims of natural disasters. It is going to be stepping in when there's a flood or a fire or some kind of disaster. I remember living in a town where the electricity was knocked out because there was a storm, and the Red Cross set up a shelter and provided food and other necessities for people. It also serves as a liaison, which is like somebody going in between two parties for members of the armed forces and their families during emergencies. They also have non-governmental services that they do, like blood drives and safety services, community volunteer services, international services. I think blood drives are actually where they make some of their money to provide the other services that they do. So also the American Red Cross is not just in the United States. There's an international movement, and it goes under other names in other countries, but it operates in other places as well. All right, so we've talked about the government health agencies, and we talked about quasi-government agencies. So those are like the two of the three types of health agencies. Non-governmental health agencies are the third type. And so quasi-government agencies receive some money from the government. Non-government health agencies don't receive any money from the government. And the advantage of this, if there is an advantage, is that there's less oversight from the government, there's less requirements, less paperwork, less regulations, and so you can operate more in a way that maybe is more efficient or maybe follows your own views about what's important. But maybe you couldn't do that with being a part of the government and receiving its funding. So where does the funding come from? It comes from private individuals or organizations, or maybe you have a membership due where people can just join your organization. You get like a monthly newsletter or some other services in exchange for that due. And usually they're started by people who feel like there's a need out there that's not being met. And so as long as the organization pays its taxes in a way that is legal, then usually the government kind of leaves it alone. Lots of different types here of non-governmental health agencies. It can be voluntary, professional, religious, philanthropic, and so on. So let's talk specifically about the voluntary health agencies. Their objective is to raise money for their program. And so maybe you feel like asthma is not getting the attention that it needs, and somebody starts an organization related to helping people who have asthma, or finding new cures, that would be research, or providing education to doctors about how to treat people with asthma, or the public in ways that they can keep somebody who has asthma healthier. Provide services to those afflicted. Maybe it would provide inhalers to people who, I guess they wouldn't probably do that because that's a medication, but they may do something, maybe a breathing mechanism or something to help them. And then advocacy, going before organizations that may be producing lots of pollution that is maybe relating to asthma, or maybe it's causing asthma in persons. So. Fundraising is a primary activity. Everything I just mentioned costs a lot of money. The problem is sometimes the organizations are really about enriching themselves, the people who start them, the people who run them, and less about helping the actual people who are suffering from the issue. So our book says to watch out for organizations that have overhead costs that account for more than 15% of the budget, which means if the director of the organization is paying themselves half of all the money that's raised, something is probably going on that shouldn't be. So, some examples of this are March of Dimes and MDA, which I forgot what that refers to. But professional health organizations are private health organizations, and they're made up of health professionals. So not necessarily just members of the public, but people who are, say, doctors or social workers. And they join this organization because they want to network and they want to improve their practice. And you pay a membership due. In social work, an example would be the NASW, National Association of Social Workers. And with membership dues, you get to be a part of conferences, and you get newsletters, and you get your name on a list, and it's a way of improving your professional practice. And one of the things that the organization does is that it tries to influence politicians and laws and regulations to promote this high standard of professional practice. Philanthropic foundations. These are started by people with lots of money, and they want to give that money for the good of humankind, specifically in this case around health issues. And so they're going to fund programs, do research on preventing health problems that we already see or future health problems that we may have, controlling current health problems so they don't grow any larger, and then treatment of diseases that people are suffering for. So for instance, Bill and Melinda Gates, Bill Gates has billions of dollars that he just can't spend, and so he creates a philanthropic foundation, and it does things like it tries to eradicate, what was the thing that he tried to do? Smallpox, I think, polio, and that is a little bit different from the volunteer organizations, because the volunteer organizations have to spend a lot of money on trying to raise funds, and so they're going to increase awareness about their organization, whereas the Bill and Melinda Gates Foundation doesn't have that issue because it already has the financial backing from them, and so it kind of frees them up to do the things that they think are most important that maybe the public may not necessarily consider as important. Service, social, and religious organizations. Okay, so there are organizations like the Kiwanis Club or the Shriners, Elks, and maybe your local religious organizations that are in existence for maybe other reasons other than health, like connecting with God, connecting with people, volunteering in the community, drinking beer, maybe not drinking beer, but they are going to be doing some things that relate to health, such as donating their space, their building, so that Alcoholics Anonymous can come in and hold a meeting there. They may sponsor food banks and provide shelters for people who are homeless. And so lots of different organizations like this that are involved in the health arena, even if that's not necessarily their main objective. The corporate involvement in community health. The biggest role is the provision of healthcare benefits. So many people in America work for corporations, and if that corporation provides healthcare benefits to the worker and maybe even to their family, this has a major impact on the health of Americans. And one of the things that's happened over the last 20 years is that health insurance costs have just gone through the roof. I think it's like 8% per year is the cost that increases every year, whereas generally inflation only goes up 1 or 2%. I know that in 2022 it's gone up a lot more than that, but generally it doesn't. And so because health insurance has gone up so much, organizations have said, well, what else can we do to try to lower the cost of health insurance? And one of the things that they've done is focus a little bit more on health promotion. And so one of the things that can happen is that the company will say, we're going to hold a Biggest Loser competition at our company, and we're going to bring in fitness equipment, and we're going to provide counseling services for people through this service that we purchased. And it's going to be cheaper usually for the company rather than having the person find maybe their own counselor in their regular community. And so it also has the benefit of making them better workers. They reduce. They're not absent as much. They're able to focus a little bit better, things like that. So, well, that is the end of my Chapter 2 slideshow.